Now, as boomers, of course, we're probably used to seeing our kids, or in some cases our grandkids, depending on how old we are, participating in sports, right? Our competitive nature, that's us, combined with our age, that's us, allows us to live sort of vicariously through the young ones without actually having to participate, watching safely from the sidelines or the stands or whatever. But, you know, our desire to have our kids compete and win at a high level comes at a price, which may include, by the way, lifelong injuries for those who play sports. Younger kids especially are vulnerable to these injuries, especially in high contact sports. You got football, soccer, hockey, very popular all over the country. So the question, I guess, is what can we as parents or grandparents do about this? Dave Ferguson is a nationally known sportscaster, international expert on athletes, and he's got a nationally syndicated program on Blog Talk Radio called Beyond the Cheers. He noted on one of his blogs that among young athletes, the amount of reported concussions has doubled in the last 10 years. Emergency room visits for concussions in kids ages 8 to 13 years old has doubled, and concussions have risen 200% among teens aged 14 to 19, and that's just in the last decade. Now, Dave joins us on the Boomers Lifeline to give us a few tips on what we can do about this. Hey, Dave Ferguson, welcome to the program. Thanks for being with us today.
Yeah, thanks very much for having me. Appreciate it.
Sure. So I kind of mentioned those stats. I know there are a whole bunch of other stats that I've got here. 1 in 5 high school athletes will sustain a sports concussion during the season. 33% of all sports concussions happen at practice. I mean, these kind of go on, and that's just from the CDC. Why the big increase in reported concussions among kids? Are we on the lookout for it more than we used to be, or sports become more violent? What's the deal with that?
I think there's a bit of both, but I like to think more that it's because of the education and awareness component has certainly gotten out there, and certainly in the past number of years when you've got high-profile athletes in hockey and in football and other sports as well that have certainly succumbed to concussive incidents, and it's certainly getting a lot more media coverage today as opposed to a number of years ago, being the nature of what we do today, of being 24/7 media coverage of pretty much everything that goes on. So I think with the educational component and the awareness piece out there, parents and some athletes are a bit more cautious and then wanting to get things checked out prior to going back to return to play guidelines. And then there's a lot more policies and procedures going right down to the granular point of where it's legislated even at some municipalities as to what transpires within their own sports leagues in the confines of their own city or town.
Dave, we know there's really no such thing as a good concussion. They're all bad, but let's talk for a minute about why damage that is caused by child concussions is just so bad.
Well, it is, and depending upon, and I don't like to downplay either of them. A hit to the head is a hit to the head. A blow to the head is the same thing. You know, when in doubt, check them out for concussive incidents. If there's any way, shape, or form that anybody is concerned, certainly it's necessary to get them checked out, and specifically at children, even if they're under the age of 13. Even to be more careful with that as their brains and skulls are still in the formative years of that as well, to make sure that they're checked out, and they do sit out a fair length of time, because even in adults, but it's different between adults and kids, but even in anybody suffering a concussive incident, the longer you wait out just to see if there are signs and symptoms, the better, because as soon as you go to a medical practitioner, if you go to the hospital to emerge, or whatever the case may be, signs and symptoms don't necessarily show up for 1, 2, or even 24 or 48 hours after the possible incident has occurred. So if anybody's in doubt with their child that has a possible concussive incident, remove them from the play for a few days and see if symptoms do develop. If they don't, then perhaps it's still worthwhile getting them checked out.
Mm-hmm. So now, of course, that's after it happens, and there's nothing you can do much except take care of it at that point. But I guess a question might be, how can we prevent this sort of thing? I mean, what kind of changes need to be made in order to keep these young kids from even getting a head injury in the first place?
Well, I think in some leagues, and I'll Pop Warner for one, I'll pick on those for a moment. They've been taking hits out of their practice because the numbers do dictate that there are more concussive incidents that occur during practice. But they're still seeing things going on out there in different areas. Specifically with tackle football, you've got 7-year-olds playing tackle football, and I think that's from the medical community that's far too young for these youngsters to be going out and playing such a sport, given the number of force from impact, even at a 7-year-old age, that really needs to be taken a look at as to, perhaps they should be playing tag football up to a certain age, and even look at people like Peyton Manning and Tom Brady, and
right.
with their own kids. Their own kids didn't play tackle football. Tom Brady didn't play tackle football till high school. Peyton Manning and Eli Manning didn't play tackle football until they were much older, until they were around 12 years old. So I think that we need to take a hard look at that as to when we're introducing a possible risk element into any sport, with that, keeping that in mind.
Well, of course, this is a big topic, not just with kids, but we're seeing this in the NFL. Where they're saying, well, we can't hit here, we can't hit there. Their actual rules are being put into place, and some of the players, even some of the fans, are saying, yeah, but this is taken away from the competitive nature of the game. I mean, why don't we all just play flag football and forget about it? Is there a way to balance, keep the competitive nature among kids' sports like you get in soccer or hockey, and at the same time, prevent these injuries from happening, or is it one or the other?
I think sports in general needs to take a good look at it. You had mentioned about the hits to the head of the suspensions and penalties that are being levied in the NFL today. We're seeing a much more attacks to the lower extremities of the body, specifically in a quarterback. But when you look at other people or other teachers or trainers that are teaching youngsters today how to give and receive hits, that's been missing for a number of years, how to do it properly. And even from my background, you had somebody that had played hockey perhaps at a high level or whatever the case may be.
Right.
This is the way they were taught. They're coming back out and instructing the kids. It may or may not be the wrong way. Bobby Hosea played in the NFL for a number of years. He currently has a number of graduates in the NFL currently in touch with. They are injury-free at this point because they know how to give and receive hits properly.
Yeah.
That's point number one. Point number two, with regards to the game itself and injuries that are sustained at the high level, and of course we all know that kids, and we've probably done it ourselves, we all emulate our
right.
hockey heroes or our football heroes, whatever the case may be there. But you need to take a look at the game today, and you ask many NFL players or even any hockey players.
Hey, Dave, I'm sorry, I apologize. I only got about 15 seconds left. It's good information. Where can they go? Is it blogtalkradio.com to get more information on this and get your show?
Sure, they can just go to beyondthetears.com and they can find all the information right there, and we talk about it on a regular basis.
Great. Thank you, Dave. I appreciate it. We're out of time. Take care.